Hi everyone, this is Dr. PJ. Today, we're going to take a closer look at Juvelook. It's a treatment I use very often in my clinic for improving skin texture, tightening pores, and personally, I rely on it a lot for treating acne scars as well. Before you get a Juvelook treatment at a dermatology clinic, there are 5 key things I really think you should know in advance. So in this video, we'll go through those 5 points one by one and break them down in an easy way. First things first, before you get a Juvelook skin or Juvelook volume treatment, it really helps to understand what this product actually is. Juvelook is often described as a cousin of Sculptra. Your body naturally produces a substance called lactic acid, and Juvelook is basically a powdered form of that ingredient. So, what happens when this lactic acid-based material is injected into the skin? Once it's inside, it slowly dissolves, almost like candy melting, and breaks down into carbon dioxide and water. Because of this, it's considered a very biocompatible material. During this slow dissolving process, it creates a mild controlled inflammatory response, which stimulates fibroblasts, the cells responsible for producing collagen. Now, because Juvelook eventually creates volume through collagen production, many patients confuse it with fillers. But Juvelook is not a filler. Fillers use a hyaluronic acid gel to give immediate volume. Juvelook, on the other hand, induces a controlled inflammatory response inside the skin, which then leads to new collagen formation over time. It's similar to how after surgery, the stitched skin becomes inflamed, fibroblasts become active, and collagen forms to close the incision. Of course, we can't intentionally create a wound just to induce inflammation. Laser treatments like Fraxel or Potenza can create similar microscopic injuries, but they can be painful and require some downtime. Juvelook, however, works from within the skin. As it melts slowly, it keeps giving gentle stimulation over several weeks. Think of it this way. If I get a Juvelook treatment every 6 weeks, it's almost like receiving tiny, gentle laser level stimulation every single day for 6 weeks straight, but in a much softer, more gradual way. Next, let's talk about where Juvelook is injected. Juvelook can be placed into 2 different layers of the skin. If you press your cheek, you will feel that firm, leathery layer. That's the dermis. And Juvelook can be injected directly into that layer. It can also be injected into the subcutaneous fat layer, which sits just beneath the dermis. Depending on your skin condition, your dermatologist may choose one of these layers or even inject it into both during the same treatment. Now, injecting directly into the dermis is trickier than you might think. The dermis is a dense network of collagen fibers. Imagine a tight mesh. Each collagen strand is only about 1 micrometer thick, but regular Juvelook particles are around 30 micrometers, and Juvelook volume particles are even larger, about 6 to 70 micrometers. Because of the size difference, it can be difficult to place Juvelook evenly into the dermis using machines. And in situations like acne scar treatment, where you need a good amount of product in very specific areas, machines can fall short. In those cases, manual injection with a syringe is usually the better approach. The second method is injecting Juvelook skin or Juvelook volume into the subcutaneous fat layer. For safety, we typically use a cannula, which is a blunt-tipped needle. Since it doesn't have a sharp tip, it's much safer. It won't pierce blood vessels or nerves. When Juvelook is placed in the subcutaneous layer, especially in both cheeks, you will usually see an overall improvement in skin texture and pore size, giving the skin a more refined, smoother appearance. Third, let's talk about how often you need Juvelook and what the ideal treatment interval is. I'll explain this based on acne scar treatment, since that's where Juvelook is used very frequently. In the past, it was common to do Juvelook every 4 weeks with a total of about 5 sessions. But recently, many dermatologists, myself included, have shifted away from that schedule. These days, instead of doing it every 4 weeks, more and more doctors are switching to a 3-month interval, and that's a protocol I personally use as well. Doing the treatment less frequently but at slightly wider intervals tend to give better collagen building and more stable results. Fourth, let's talk about where Juvelook skin and Juvelook volume are typically injected and whether there are any areas that should be avoided. These 2 products work differently, so their injection zones aren't the same. First, With regular Juvelook, we mainly inject it within the dermis. Because it stays in the superficial layer, it can be used almost anywhere on the face. The only exceptions are the eye area and the eyelids, where it should never be injected. But aside from that, dermal injections with regular Juvelook are generally safe across the face. Now, Juvelook volume is different. This one is injected deeper into the subcutaneous fat layer, usually with a cannula. Because of that deeper placement, it's mostly used in that cheek area. It can be injected into the forehead, but it's not very common. And just like with regular Juvelook, it should not be injected around the eyes. Lastly, a lot of people think Juvelook is the same as Rejuran or Sculptra, and they are not quite sure how to tell them apart. So, before you get the treatment, it helps to clearly understand the differences between these three. Let's start with Rejuran. Rejuran uses polynucleotides, and while it's great for overall skin hydration and glow, it's not the strongest option for lifting acne scars or tightening pores. The effect is beautiful. Your skin looks dewy and healthy, but it doesn't last very long. For example, if you have a wedding in a month or two, getting Rejuran 3 times at 1 month intervals can give you that fresh, radiant look. Next is Sculptra, one of the most well-known collagen stimulators. Sculptra is more similar to Juvelook volume, but it's much stronger. And here's the important part. Sculptra should never be injected into the dermis because it can cause nodules. So, Sculptra must be placed deep, usually with a cannula, especially in hollow cheeks, to gradually restore volume. And finally, we have Juvelook. This one is the most versatile of the three. Like Rejuran, it can be injected into the dermis to improve texture and pores. But similar to Sculptra, it can also be placed deep to gentle correct mild volume loss or fill in depressed acne scars with more precision. Today, we went over the 5 things you absolutely need to know before getting a Juvelook treatment at a clinic. Remember, Juvelook is not a filler, it's not Sculptra, and it's not Rejuran either. Juvelook works by gently and gradually boosting your own collagen, which is why it's great for improving skin texture, pores, acne scars, and even mild volume loss, all while being a very safe treatment. I hope today's explanation helps you feel more confident and informed before your next dermatology visit. If you have any other questions, feel free to leave them in the comments. I'll be very happy to answer them. And if this video was helpful, don't forget to like, subscribe, and turn on the notification bell. This has been Dr. PJ. Thank you so much for watching.